Welcome to my question answering series. We'll jump right in. I'm going to start with the very first question that came up when I posted this video. And it comes from How It's Possible, who says, "Hello sir, I have an uneven face, a long and narrow upper jaw, and doing mewing, and also facing a problem of clicking jaw so badly. So how to treat this, and is it okay to do mewing?" Now, you can see in that question, it's really three different questions, so let's answer the simplest one first. Is it okay to do mewing? Yes, for the most part, it's okay to do mewing, which is the practice of putting the tongue up on the roof of the mouth and holding it there with some pressure for a period of time, I would say 5, 10, maybe 30 seconds, in order to strengthen the muscles of the tongue that elevate it and move it forward. This helps to support the airway, and it helps to flatten the submental triangle, which can be beneficial for facial aesthetics. If you want to learn more about this, I would recommend that you visit Orthotropics, the YouTube channel called Orthotropics by Dr. Michael Mew out of the UK. He's the one who first described this process, which went viral on the internet, and it became named after him, actually. So I would consider him the expert. Now, there was another question about mewing from Sashwat Shri, which says, "I have TMJ, but can I still do the exercises like mewing to make my jaws look good?" And I would say, to an extent that they don't harm the already damaged joint structures, that would be fine. And to the extent that they don't continually overwork the perhaps already overworked muscular structures, that would be fine. You'll have to use your own discretion for this. Just notice that if you do too much of any particular exercise, and mewing would be included in this, if it causes your structures or your muscles to become sore or painful or fatigued or too tired, then it might be a good idea to cut back a little bit on that practice. Now, the second part of that question was about a clicking jaw so badly, wondering how to treat it. And Akash Chowdhury replied to this question, actually, who says, "Watch his clicking jaw series. It's very helpful. I've been doing part 3 of the exercise for the past 3 months, and results are amazing. My face has become so much more symmetrical than before, and clicking has reduced a lot. Thank you very much. I appreciate the vote of confidence, and I hope this has helped other people as well." There was also a question from Weedod KH, who says, "I want the solution of popping of the jaw on one side." Now, Daily Bread Daily responded to this, saying, "The only thing I've seen that helped people is BOTOX by making it numb." To which Weedod KH replied, "It is not a solution." And I would agree with you, Weedod KH, BOTOX is typically not a solution for popping of the jaw. But if BOTOX reduces activity in the elevator muscles such as the masseter and temporalis, then it can reduce the load being placed on the jaw joint during functional movements such as chewing, and in that way, for some people, it could reduce, maybe even eliminate the perception of clicking of the jaw. But if somebody came to my office with the primary chief complaint of clicking in the jaw joints, and they asked me if BOTOX would help, I would tell them it could, but there's no way to predict it. You'd have to try it first to find out, and I wouldn't personally bet on it. So Krishna KD also says, "Not pain, but clicking sound irritate me. Please help me, sir, from India." And then back to Akash Chowdhury, who also says, "Sir, I had clicking jaw issues, which has reduced a lot after one of the exercises you showed in your clicking jaw series. So my question is, should I do that exercise until the click goes away completely? Thank you very much for your videos." We are very welcome, and I'm glad that they've been helpful. And the answer to this question is kind of a long one. Will a click in the jaw go away? Sometimes it does, sometimes it doesn't. It's like a click in any other joint. I've had a click in my ankle for as long as I can remember. It doesn't hurt, it doesn't cause me any dysfunction, but it's there and it's annoying. And this is what I hear a lot from patients who come into my practice with that symptom of a clicking jaw. The point of any therapeutic approach is to protect the structures that are injured or dysfunctional, and then to engage in some sort of physical therapy, some rehabituation, reprogramming of muscle movement patterns so that your habitual patterns on a daily basis and an hourly basis and a moment-by-moment basis don't continually place excessive loads on these joint structures to make that problem progress and make it get worse over time. What we want to do is we want these structures to adapt in a way that's favorable so that they become more functional, less painful, and perhaps less noisy and annoying. From my perspective as the treating doctor, I love it when my patients experience a reduction in the clicking in their jaws, but I don't expect this to be an outcome because it's very unpredictable for me. The best I feel like I can do is follow the therapeutic approach, give my patients exercises that should help with the problem, and design them some sort of orthotic device to protect the damaged structures. Now, the third part of that first question was really about facial asymmetry, but that really wasn't the question. It was just a statement about having an uneven face. And in the first batch of responses on this video, I didn't see a lot of concern over facial asymmetry, so I'm going to save that one for the next video. All right, so far that's 2 questions, the first one being about mewing, the second one being about clicking and popping in the jaw. That brings us to question number 3, which is about surgery, and there were a couple people who asked about surgery in this first batch. FrimGuy10 says, if I get double jaw surgery, will it make my TMJ pain go away? Frank Boris says, I injured my neck, caused my condyle to push back into my right ear canal, crepitus, sound, and pressure. I wear a splint. It's going on a little over a year. Will it get better with time, or do I need surgery? So the basic question here is, will surgery correct pain? And that depends. If the structure that is going to be corrected with surgery is the cause of the pain, then it should help. Take back surgery, for example. If somebody has a disc in between 2 of the vertebrae of the spine and the disc is smushed or compressed, then the spinal column can be putting pressure on a nerve, which can be causing pain. Now, if a surgeon can go in there and put some reinforcement to hold those 2 vertebrae apart and stabilize them, then that should reduce or eliminate the pain that person was feeling from the compression of that nerve. That's typically not what's happening in the jaw joint, though, and jaw joint symptoms, TMJ dysfunction symptoms, are pretty complex in the way that they arise. Even with a very detailed diagnostic examination, sometimes I can't get to the source of a person's pain, so we're left with a little bit of guesswork. So here's what I would say about surgery. If you've had significant degenerative joint disease, or if your airway is completely restricted because you never had complete formation of that lower jaw, that horizontal development of the lower jaw, those are 2 reasons to go for jaw surgery, because it can correct those structural problems. But that's not pain, and those structural problems don't necessarily cause pain. So the way this thought process works with surgery is, we try to diagnose where the pain's coming from first. We develop a hypothesis. Then we test the hypothesis by doing something to reduce or eliminate stress and strain on the structure that we think is causing the pain. Or if it's a muscle, we try to reduce the activity in the muscle, like with an oral muscle relaxant, a topical compound of medication, or something like BOTOX. And then the third thing is we try to establish new muscle movement patterns to see if we can address things in a conservative fashion. If we can, then we don't need to go to that next step of surgery. If we can't eliminate pain with using those conservative measures, we still don't know if surgery is going to correct the pain. All we can know is that surgery has the ability to correct structural defects, structural compromises. If something seems like it's out of position, we can put it back into position or remove it altogether. That's typically what gets done with a disc that's making a clicking noise, especially if a person has a situation where their jaw is getting locked or when it clicks, it hurts. If we take the disc out, you're going to lose some joint support. So there's a risk with any type of surgery that you do, and you have to work with your surgeon to weigh the risks and the benefits before going forward into any kind of surgical procedure, and understand that nobody can predict for you whether or not that surgical procedure is going to have a beneficial effect on your pain. The fourth question is about injuries and how they heal. And there were 3 questions in this batch that had to do with injuries and healing. The first was from Ne vous abonnez pas. I think I'm pronouncing that right, but forgive me, I don't speak French. I think that's French. Does wearing a headset on a regular basis make TMJ problems worse? The second question about injury from Oral Zilberman. Hello there, thanks for taking the time to answer questions. My question is, around 13 years ago while driving, I bit the mouthpiece too strong for too long and my jaw popped. Ever since, I have mild TMJ. The popping is not so bad, but if I chew too much, it becomes more rigid and it's harder for me to open my mouth. What would you suggest me to do? Will it get stiffer with the ears or stay mild until taken care of? Thanks in advance. The third question about injuries comes from Dargo5496, who says, how to know if TM joint is injured or strained muscle, pain in front of my ear when I open my mouth. So an injury can happen to the joints, to the muscles, to the tendons, to the ligaments, to the bones, to the teeth. There's a lot of structures that could get injured when we use the jaw in ways that the structures can't tolerate in their current configuration. So to the first question, well, does it hurt TMJ problems if I wear a headset? Well, it depends on the headset, right? I have AirPods that fit inside my ear and can put pressure on the retrodiscal structures, the back of the condyle of the jaw when you close. So for some people, if those structures are inflamed, chronically inflamed, wearing AirPods or even hearing aids can be problematic and can irritate those inflamed structures every time if you have those things in for too long. There are other types of headphones like the on the ear and over the ear types of headphones that you can try out to see which ones are more comfortable. That being said, I think this is more of a symptom situation than it is an exacerbation of the issue or making the problem worse over time. I'm just speculating here, but I don't think that wearing headphones and causing that area in front of the ear where the jaw joint is to become irritated is going to accelerate significantly any kind of degenerative process that might be taking place within the joints. I think that's possibly a factor, but a very, very small factor. It's far outweighed by the way that you use your teeth, the way that you chew food, and how much you may clench or grind your teeth together or hold chronic tension and strain in your jaw muscles. The second question about biting a mouthpiece too hard and hearing a pop and then having your jaw hurt for a while, that sounds like it has to do with a disc that was it was teetering on the edge, almost out of place, and finally from chronic compression of the muscles squeezing the condyle into the fossa of the jaw joint, you were able to squeeze that condyle behind the disc. It caused a snap, maybe stretched a ligament, and that resulted in some inflammation and some pain. That's typically what I think happens with jaw joints as they progress along this path of joint dysfunction and disc dislocation. There's no way for me to predict whether it's going to get better over time or stay steady or get worse over time. All we can do is try to tip the scales, tip the balance in favor of favorable adaptation, in favor of comfort and good function, as opposed to dysfunction and degenerative processes like degenerative joint disease and chronic inflammation. So in that case, if you don't do anything, you don't change anything about the way you eat, about the way you talk, clenching your teeth, all of that stuff, if you do nothing, then your risk of developing a degenerative condition is going to be higher than if you do something to reduce the compressive strain on the joint structures and to improve good biomechanics. And then the third part of that question, how do I know if the pain is coming from the joint or the muscle? That's one of the primary things that I deal with in my practice on that first visit. We try to determine, is the pain, and it's usually pain that brings people in, is the pain coming from the joint, from the muscle, or is it neurological? So there isn't really a great way to tell if pain is coming from a muscle, because I think sometimes when we have pain that's originating in the muscle tissue or the fascia, if I push on the muscle, it doesn't necessarily hurt. But joint structures are different. If there's inflammation in the joint and I press on it right here in front of your ear, where you described, that's going to hurt if it's inflamed. If that's sore to press on, then you've probably got some level of a joint problem, and engaging in some form of protection for that joint structure, like an orthotic device, would probably be a good idea for you. If you push here right in front of the ear, and that area of your face doesn't hurt when you press on it, if you move your jaw up and down, and you feel that condyle moving around, and you can do that comfortably and it doesn't hurt with 1 to 2 pounds of pressure, then you probably don't have significant inflammation in the joint structures themselves. Then you could lean toward it may be a muscular or myofascial type of a problem, or a little bit more rare neurological condition. Now, Dargo5496 said specifically it hurts right in front of my ear when I open my mouth. That sounds like a joint problem. It sounds like a disc dislocation. When you get to a certain point, it starts to hurt right there in front of the ear. That would be a good reason to go see a TMJ specialist or engage in some form of rehabilitation program, like through my app or the teachable course that I have online, in order to get your range of motion back without further damaging those structures. And the last question for this batch, question number 5, has to do with BOTOX, and Daily Bread Daily says, is BOTOX worth it? Any side effects if done too much for TMJ? Camus444 replied, it leads to muscle atrophy. Daily Bread Daily replied, but will constant clicking of my TMJ lead to muscle atrophy as well? Pretty good questions. So let's start with the first one. Is Botox worth it? The only way you're going to know is if you do it to determine whether or not your symptoms are related to chronic excessive functioning or parafunctioning of those muscles. But I could tell you that in my practice, Botox has been a game changer, and it's something that has helped a lot of people that I didn't really have another tool for. So I would encourage anyone who has pain here or in a lot of activity in these masseter muscles to try Botox and see if it's helpful. It has been in my practice. A drawback of Botox is that you typically have to administer it every 3 to 6 months and keep doing that as long as the muscle function continues at the rate that it is, where it's above your threshold for pain. If you can find a way to reduce muscle activity without having to administer Botox, then you've got a solution to the problem without having to have this medication injected into your muscles every 3 to 6 months. And those solutions typically involve different forms of relaxation techniques and awareness techniques and reducing stress in your life or changing the way that you engage with the stress in your life. Now, regarding Botox leading to muscle atrophy, yes, indeed, Botox can lead to muscle atrophy, and we can do that deliberately if people have overgrowth or hypertrophy of these masseter muscles to the point where the muscles are just chronically overloading those joint structures. Sometimes we cause muscle atrophy on purpose, meaning the muscle actually shrinks in size. Most of the time, if we stay within 20 to 30 units of Botox per masseter muscle, it doesn't cause a significant noticeable change in somebody's appearance. And if you wait the full 3 months so that that Botox medication, that neuromodulator, has completely cleared out of your system before you administer more, then you're typically not going to have a cumulative effect over time. So that's the 5 questions for this batch. I hope this has been helpful. I look forward to answering more of your questions as we go forward.